Hello, hi, thanks for having us. My name is Kate Smith. I'm Senior Commissioning Manager for West Hampshire CCG, and as a few people have already mentioned, we're the kind of people that people get quite cross with at times and say with a certain tone in their voice. But absolutely, I think commissioners are definitely recognising the importance of being involved and actually how much they can affect change. Karen Pearce and I are going to do a bit of a double act. Karen's the Director of Care for the M&D Association, and we're just going to present to you what has happened since February's summit. We haven't actually done all this work, we're just presenting on behalf of a lot of people, and Karen's going to make everybody stand up who's the leads of the programmes. Just to remind you of the vision that we discussed at the February summit, and we've kind of put it in. I'm looking backwards and it's not backwards, is it? We've put it into kind of two sections: holistic and integrated services, and effective and fast, both of which are quite easy to say and very difficult to do. Some of the ambitions that we also discussed at the February summit that the work streams fell out of were around integration of health and social care, personalisation and meeting individuals' needs, responsive services, users always being involved in the developments, and 24-hour access to repair and maintenance. Kind of whiz through that just to say what we remind you of what happened in February. So what's happened since February? Well, all the action plan that came out of the summit has been reviewed and the work streams were identified. There were 6 work streams, as has been said: empowered service users and carers, holistic assessment, commissioning and procurement, integration of health and social care, training for staff, and use of innovation. Use of innovation runs through all of them, as does service user engagement and input. So stakeholders were identified and a number of meetings held under each work stream, and they have been scoped and the deliverables identified from each one of them, because what we didn't want to do was kind of just keep going with lots of talking but actually not really identify what each one was going to deliver. And early thoughts and plans and drafts of various different products have been tested. Now, I'm going to put the commissioning cycle up now, and you're probably all going to go a bit glassy-eyed. But one of the ways we can really affect change in this, as has been mentioned a few times before, is really actually giving commissioners the tools to get this right. I spent the last 3 years working with a lot of people in the room around our local services, and we've been around this cycle and we've learnt an awful lot through it. So the commissioning cycle is effectively, it's quite a simple process really. You plan and you look at what you need to do. You design what you want to do to meet what your needs are, and then you make sure it's actually being delivered. So you monitor what's being delivered, and you just keep going around this cycle, making continuous improvement. One of the things that we don't have at the moment for wheelchair services are standard what good looks like specification. We don't have data sets that we can compare against, and we know that everybody is starting from different positions. The work streams absolutely will feed into all the aspects of the commissioning cycle to actually make this an easier process to commission good services. The case for change, which a lot of people have been referring to, and Fiona especially mentioned, how do we articulate what the long-term costs of this are in getting it right, and how health and social care, and I mean that in the widest possible sense, how do we articulate what it means to get this right, and how do we facilitate the funding model to actually do it? We've also got, I've kind of colour-coded it so it matches with the commissioning cycle, but the specification is really, really important here. What are we expecting? What do we really want this service to look like? What are the standards we're wanting to adhere to? Things like that will include a holistic assessment. They will include the training for staff, what quality staff and kind of what experience do you expect, and then going out to actually procure that. So we've got a really good specification, really good outcomes associated with that across health and social care, and then how do we monitor it? How do we really know that we're getting what we need and the specifications being delivered, and how can we, as before that was mentioned, how do we compare all the different services? To actually, and again, this is a bit kind of the approach that we're taking, but to really kind of give confidence in the delivery of some of these things, we thought we probably needed a programme structure to this, so that actually all the leads from the different work streams, actually we are all aiming for the same thing, and there is many-way excuse me, I've got a cold, many-way communication through all the work streams and to the steering group and NHS England and NHS IQ. How do we all work together to do it? So this is the structure that we've come up with, and some of the key things that we really, really need to do is look at the time scales and the commitment, which is obviously what we're here to do, so that we can see that real change to those individuals. Okay, so that's the kind of quite dry bit. I'm going to hand over to Karen, who will give you a bit more information on each of the work streams. So, Green.
Thanks very much, Kate. It's a bit of a song and a dance act, but you wouldn't want me to sing and you wouldn't want me to dance either. So I'm going to give a brief overview of where the work streams are at this moment in time. This isn't my work, it's the work of a lot of people in this room. And as I feed back what the achievements are so far, if I don't get it right, there are members of those work streams here, and they'll be able to say that's not quite right. And I'll also identify who some of those people are so that you'll know, and it's important that you will know, because at lunchtime I'm hoping that you will help us to know more about what we should be doing to reflect your views, and your views are crucially important. The first work stream is informed and empowered service users and carers. There's been an update on this slide. It came hot off the press last night, and it came from Paula and Jenny. Paula and Jenny identify where they are. Here's Paula, and Jenny's at the back there. So if you've got any comments and you want to help, Paula and Jenny would love to hear your comments, they'd love to hear your views, and they would also love you to help them to write this piece of work when it comes to near to completion. Their focus is on developing an information pack, and the key headlines for that information pack will be living life on wheels, wheelchair services, independent living, empowering wheelchair service users and their carers, choosing your chair, maintenance. We've already had that referenced earlier on about if the caster's not there. People usually know if their caster isn't on their wheelchair. You don't need someone to go and assess for it. Safety and training, vitally important for users and their carers, and also frequently asked questions. So if you have thoughts on that, you'll have opportunity to add to those later on in the day. The second work stream was around holistic assessment and the prescription of wheelchairs. I'm here, that's me, who's leading the work stream, and I'm sure there are other members of the work stream in the room, and we would love also to hear your feedback. We are going to design the principles of a holistic assessment, but based completely around the user and the carer, so that any standards that are created underneath those principles can be measured, and those outcomes are measured by user statements, so statements like my chair is comfortable and ensures I can do the things I need, I want and I need to do. Those things can be measured. They're person-reported outcomes. And the principles and the standards that we'll be working to, a lot of them are already there. We can build on the work of the National Wheelchair Managers Forum, on the Postural Mobility Group, on organisations like CCOPS, who have already got a code of practice for equipment services, but are also developing practices for wheelchair services too. These things can be built on, and we can move forward and make sure we have a holistic assessment, and the vital component of that will be around management of posture, which we've already heard mentioned so movingly in the films we heard earlier on this morning. The third work stream is around commissioning and procurement, and Kate seemed to be quite apologetic about her wheelchair, her commissioning pathway and the processes and the structures. But actually, if we don't have those to work to, we'll be floundering in the dark. So actually, structure is vitally important. It's going to be vitally important as services move from different ways of funding. So specialist services and specialist wheelchair provision is moving from NHS England to clinical commissioning groups in April of next year. So the work we're doing today and going forward is hugely important so that we can empower clinical commissioning groups to know what they need to commission, what users and their carers need, want, to make sure that they've got an independent life, that they can do what they want to do, both at home, but at work, in education, and also in their leisure time. One of the real problems is that there hasn't been enough information, there hasn't been good, strong data. So the data set is going to be crucial to give an understanding so that we can get some benchmarking, so we can hopefully get a bit of competition maybe between clinical commissioning groups who see something being done in one area really well, and actually maybe they could do better, so that we can start driving up an equal standard, and so we can see some uniformity right across the country. The service specification is going to be crucial, absolutely vitally important, and I really would like to see some timescales on when that will be embedded and approved. It's going to give clinical commissioners a real roadmap on what they should and could be doing. And of course, nothing can be done without funding. We've got a real problem around funding. It's been mentioned before. It's one of those real challenges. We know that it's not easy to provide good services, and people are very concerned about additional funding. Well, we need to look at some of the innovative stuff that we can do first, and then look for more funding. I think they both go hand in hand. The fourth, if I'm counting this right, the fourth work stream is integration of health and social care. I think we have quite a medical model in a way, and we need to reinforce the importance of involving a real integrated and multi-agency approach. This is about health, this is about social care, this is about education, it's about the workplace. So it's about stopping silo working, and the integration of health and social care group has been looking at that, looking at the integration of processes across all of those areas, and creating principles for integrated commissioning. And those principles, interestingly and unsurprisingly, have got a commonality across principles of a holistic assessment and also the principles of a robust service specification. What was quite interesting is a piece of work that Chloe Carter from the British Red Cross did. She looked at a number of health and wellbeing boards and asked the question, do they mention wheelchair services? And of 138 health and wellbeing boards, only 2 mentioned wheelchair services in their joint strategic needs assessments. Now, those joint strategic needs assessments identify need as identified by users and providers of services, and they collectively can drive the actions of the National Health Service, of local government, and include the engagement of the communities around them. So if anybody's on a health and wellbeing board, there's a gap there, and you need to be thinking about how you might fill it. The fifth work stream is training for staff, and Stan and Paula have been working very hard on this. It's crucial that we make sure that our current workforce and those people in training and the workforce for the future have got the real skills to support people who are using wheelchairs. It's vitally important that they don't just think about the person in front of them and what they need sitting in front of them. They really must think about the environment around them. It was Fiona mentioned earlier on about getting out and about. Vitally important. Fiona's playing basketball. She needs the right wheelchair to enable her to do that and to have a healthy and enjoyable social life as well as getting to work. So we need to make sure that staff are trained to think about those aspects of a person's life, and also to think about the impact on carers to ensure that they can continue caring for people. We need to make sure that people have been trained to have the right skills. If you've got a specialist, and ensure that they're looking at the most complex cases, make sure that they're focusing on the work that they're trained to do, so that you've got the right people doing the right thing at the right time, so that you get the right chair at the right time. And it's vitally important that people are trained to anticipate future need. You mustn't think about the here and now. The here and now and what for the future is what's going to make sure that you actually have an efficient and effective services providing what people need. And going right the way through all of that is innovation. Innovation doesn't stand alone. Innovation isn't just about thinking about new technical kit. Innovation is about freeing up thought. I didn't think I'd actually have to try and think through the eyes of somebody from the mafia this morning, but hey, there you go. We need to capture and showcase your ideas. We need to know what innovation is out there, what best practice or good practice is out there. And it's a real opportunity for you to have a voice and to have that actually broadcast, if you like, to the world through a new innovation portal that is going to be launched today. It's an online portal that is hosted by NHS England, and if you have got something that you'd like to showcase, please make sure that you get it, your ideas and your thoughts or your services onto that portal. The opportunity to make sure that you have a say in all of this is vital. We know why we're all here today. I think we've had a really good introduction to today, and we've got so many people who are passionate about making a difference. For me and for many people in the room, we need to define some timescales. We need to know when we're going to deliver this. Let's put some times in the, as a benchmark. Where are we aiming for? Because that will really focus thinking. It will help the work streams to deliver. But we can't do that on our own. So we need the collective ideas of the people in the room. We welcome your comments. We welcome, if we've got it wrong, we need you to tell us, otherwise we'll continue to do the wrong thing. And the work streams over lunch will be standing pasted across that wall down there. So you'll see each of the slides that have been shown are over there. And if you've got some thoughts or some ideas, please come and tell us. We would welcome hearing from you because it will help us to develop what we need to develop. So in the room, we've got a huge number of people. Together we can have a voice for change, and we can make that voice heard. We can design collectively our campaign. It's our campaign. We can move this forward to make a difference. And what we really need to do is to make sure that this time change really happens. Thank you very much.